Hello, good evening. I have just been at a meeting, so I just come back from my meeting, so I'm sorry if this is a bit late, but I'm here and I've got some questions lined up. But as ever, if there are any questions live, feel free to ask them live. We are going to, what we are doing here, in case you're wondering, is we are doing, oh no, sorry, wrong one. We are doing live Q&A with me, Jonathan Stoiano, plastic surgeon to the stars. So if you've got any questions, please feel free to comment and share this. And I will get my, what the date, 17th today. So there we go. We've got some questions here. So first question is about dog ears after a tummy tuck. So this is a patient asking about what is the best way to, what's the plan, what's the progress with them. Dog ears are common after a lot of plastic surgery procedures because they happen whenever you cut a bit of tissue out. If you just make a cut in the skin and stitch it up, you don't get a dog ear, you get a flat scar. But as soon as you start cutting tissue out, when you've cut that tissue out and you bring it together, you get a little bulge at the end of the scar. So it can happen with tummy tucks, it can happen with facelifts, it can happen with mastopexies, it can happen with blepharoplasties, or taking, anytime you're cutting skin out, thigh lifts, arm lifts, anytime you're cutting skin out. And we do a lot of things to try and empty out the dog ear and reduce the dog ear. The best way to get rid of a dog ear, now if you can think of it, that it's two ends of the spectrum. So one end of the spectrum is you've got cutting a straight line and stitching it up, no dog ear. Worst dog ear is a circle. If you cut out a circle and try and stitch up the circle, you get massive dog ears. So you've got to go somewhere in between, and somewhere in between means taking it into an ellipse. And the sort of longer the ellipse and the narrower the ellipse is at the end, the smaller your dog ears, but the longer your scar. So when we're doing a tummy tuck, I'm trying to make the scar as short as possible, but I'm trying to make the dog ears as small as possible. So it's a balance between those two things. And sometimes you get a bit of a dog ear. And the good news is they're easy to treat. So it's nothing to particularly worry about. But you have to let things settle, particularly if you've had things like liposuction or what have you at the sides, because that makes it quite swollen. Even if you haven't had liposuction, to be honest, it's quite swollen because I try and empty those dog ears, so you can be a bit of swelling and things in those areas, and it can be a bit of a bulge. You think, I'm not sure about this. So you have to leave it a few months. So I say minimum really 3 months, minimum 3 months to leave it to settle. Hopefully when it all settles, it's fine. If it doesn't, then it's easy to fix. The longer you leave it, the better, to be honest. 3 months would be the minimum, but if things are starting to get better, I'd probably leave it longer because they often do settle and they rarely need to be treated. But sometimes, I say rarely, sometimes they do. So that's something that's it's all included. If you do have to have them treated, you don't have to pay or anything like that. So that's something that can happen. And so, but if it does, we can rebuild you. We can fix it. So don't worry about it. But I think it's going to be okay. I don't think this particular person asking, I think they're going to be okay personally. But that is a possibility. So xanthelasma. Xanthelasmata is the plural. Xanthelasma are little spots around the eye, usually around what we call the medial canthus. Are you getting this, camera one? Usually around the medial canthus, the inner aspect of the eye. Little yellow spots or plaques, and they're cholesterol deposits. That's what they are. So number one thing is you need to make sure you get your cholesterol checked if you've got them, because it could be a sign that you've got a high cholesterol, and if you've got a high cholesterol, that can predispose to heart disease. So you should get that checked out and make sure that you're. Am I a bit close? Back off. Actually, I'll put the camera further back. Oh god. Get your cholesterol checked, because if your cholesterol is high, then that might need to be addressed. Even if your cholesterol might be normal though. So, but that's the first thing: get your cholesterol checked. The actual treatment of them themselves is you can cut them out. They will leave you with scars. To be honest with you, scars around the eyes are usually pretty good because you've got quite a lot of wrinkles around your eyes because you're opening and closing your eyes all the time. So there's wrinkles. Not someone as young as me, obviously, not with the amount of surgery I've had, but there are often wrinkles around the eye and lines around the eye. So we try and make the scars look like the lines. So the scars are usually pretty good, but it's something that's relatively easy to fix. It can be done under a local anaesthetic. But as I say, it will leave scars, but usually the scars are less obvious than the xanthelasmata or the xanthelasma. Am I going through these too quick? I'm going to get through these. I know you're thinking of questions out there, so by all means think away, and you don't have to. Where's my thing? Comment and share if you don't want to, that's fine, but if you do, that's fine too. Whatever you feel comfortable with. So what we've got now is we've got a patient who's asked a question. I've got the email here. I'd like to discuss the breast reduction and lift. I'm not sure if I will need implants. I'm looking at the best option for me with advice. Thanks. So right then, this is actually a good question. Not that, I mean, they're all good questions, but this is a good one because okay, breast reduction and lift. Breast reduction and lift are the same thing, but a breast reduction makes the breast smaller. A lift keeps the breast the same size. So they both lift the breast. So a breast lift is part of a breast reduction. So sometimes people say, oh, I need a breast reduction, but I think I need a lift as well. A lift is actually a part of it. So a lift is sort of integral with a breast reduction. So there's two things with the breast: shape and size. And the best way to address the shape is a lift. A lift will make the shape better. It will lift the breast and make the shape better, but it'll do nothing to the size. So if you want something done to the size, that is when you come into a reduction if they're too big to make them smaller, or implants to make them bigger if they're too small. So interestingly, what this patient's asking, I'm not sure what the angle is with regards to the implants, but so the question I'd say to you is, if you're unhappy with the shape, and you almost see a little diagram. I could just make a diagram, couldn't I? I think I did actually for a talk I gave once. Anyway, if you're unhappy with the shape, then lift. If they're too big, reduction. And if they're too small, implants. And if they're too small and you're unhappy with the shape, you can have a lift with implants. So you might say, well, why is this person asking about implants? Because it's an interesting concept, because she's saying, I think I might need a reduction and I'm not sure whether I need implants. Some surgeons will do a reduction and implants, and you might think that sounds a bit weird. It's not something that I do because I don't like removing breast tissue and then replacing it with implants. I don't like doing that as a concept, but some surgeons will do that. And the reason they'll do that is because if you're having a breast lift or a breast reduction, one of the big things is managing expectations. So what I'll do is I'll show you photos of what can be achieved, because when you have a breast lift or a breast reduction, the volume is up here and then it settles and you get a sort of a concavity in the upper pole as the breast settles. And you have to be aware of that before you have the surgery, because you might have the surgery and think, this is exactly what I want. I'm so happy when you first have it done. But when they settle, you might think, wait a minute, they settle a bit. Shape's not quite right. So you need to be aware of what sort of shape you can achieve before you have surgery. Now, obviously, it settles a bit. So out of a bra, you will have a bit of a concavity. You can always put them in a bra and push them up. But you might say you could do that already, with it. You don't need a mastopexy because you can push them in a bra now. So you have to be aware of the sort of shape that you can achieve when you're having a breast lift and a breast reduction. If you are unhappy with the shape that can be achieved, if you're unhappy with that concavity and you say, you know what, I want a bit of, someone's commented, thank goodness for that. Oh, I can't. Hello, Angie. Thanks for hello, nice to see you. if you are unhappy with the shape that you get with a lift or a reduction, then an implant is the only real way to get stable fullness in the upper pole. An implant doesn't settle. Breast tissue, because it's your own tissue, you can put it up there. When you do a lift and reduction, you put it up there, you make it as high as you can. Because of gravity, it goes, and then if you want to keep some fullness up there, you have to have a implant. An implant is the only way to give you fullness up there. The problem with implants is they make your breast bigger. So if your breasts are too big, so this patient's saying, do I need a breast reduction? I'm assuming her breasts are too big. If your breasts are too big, you think, well, how can I do implants? Well, some people will do it, they'll reduce the breast and then put an implant in to give a better shape, what they might perceive to be a better shape because it's fuller in the upper pole. But you've got all the problems associated with implants. For me, my advice is I think implants are really good at making the breast bigger. So if your breast is too small, I think they're fantastic. But if you just to use it purely for shape, I'd say, look, is it worth it? I don't really think it's worth it because there are potential complications that you can get with implants, particularly if you're doing a lift or a reduction, because there's lots of scarring with that sort of associated with that. And if you get any wound healing problems, if the implant becomes exposed or becomes infected, you have to remove it. So there's significant complications associated with using implants at the time of a breast lift or a reduction. And so I would always advise people to just have the lift stroke reduction, see how you go. If you weren't happy, you could always at a later date have implants, but I wouldn't go with a breast reduction and implants. It's not something that I personally would go with, but some surgeons do. So it's not like it's wrong. It's just my view on that one. Hi, Karen. Have you spelt your name differently? Has it always been like that? Or is that a different Karen Holmes? Karen, I thought it was. Anyway, Caron. Well, we've got Ange. Is it Angie? Maybe it's Angie. And we got Caron. Maybe that's Karen. But good to see you all. Nice to see that you're pushing the boundaries of the first names. That's always good to see. So what is in store for us is another question. That was just a smiling one. What's that? What we got now, this is an interesting issue here. Cosmetic surgery abroad. I had an inquiry, I think, today from a patient from France. So it works both ways, cosmetic surgery abroad. We get people who inquire who are from abroad who want to come to have surgery here. And it also works the other way, because I saw someone on Friday who had a breast reduction in the Dominican Republic 5 weeks ago, and she had she had some problems with discharge and problems with the wound and redness and some issues that she was concerned about. And it's very difficult, that situation. I think that she'd been going down the route of NHS treatment prior to seeking private treatment. And when she had private treatment in the Dominican Republic, she felt that if she had problems that the NHS would help her. But the NHS have said to her, look, you need to, you've had it done privately, you need to seek help privately. So she came to see me. But it is a difficult problem. And the thing that I would say is that, apparently it's a 10-hour flight. And the reason one of the reasons people have surgery abroad is because it's cheaper. And really, when you have problems with the surgery, the best bet is actually your surgeon. And I think, the surgeon's obviously based there. And I think she's got a handler, I can't remember what you called it now, but a sort of like a representative in this country. But the representative had to speak to the surgeon. I don't think they're medical themselves. And she was getting a lot of time before she was getting the answers, and she was kind of frustrated and really wanted someone to look after her. But really, the answer is that her surgeon has got a duty of care. What we have, the way we work, is that the money that we get paid as surgeons, we get paid when we do the surgery. That's in the private sector. In the work that mainly that we do at the clinic is mainly self-pay, so it's not insured. So you really only get paid when you do the surgery. The aftercare we don't get paid for because of pay in terms of directly. I mean, obviously you paid for it because you paid, but you pay up front. You pay for the surgery, and so the aftercare is all part of the service. So you can't really have surgery in Dominican Republic and then come and have aftercare with me, for instance, and you know, and then have me as your surgeon, sort of thing. If I didn't do the initial surgery, your aftercare really needs to be with your initial practitioner. So it is something that you don't really tend to think about before the surgery, I think, or not you. People don't tend to think about it. Um, um, and So, but I think it is important. It is something that you need to think about, and it goes both ways. So, people coming from France, people coming from overseas, coming here, I'll say to them, "Look, you know what? Of course, I'll happily see you and treat you, and I will look after you. But I would advise you to go locally, to be quite honest with you, because there are very good surgeons in France, and there are very good surgeons in Dominican Republic and Prague, and I don't know, wherever else people go, Cuba, and you know, there are good surgeons in these places. I think the problem is not so much that there are bad surgeons, you know, all the surgeons there are bad and all the surgeons here are good. It's not that the surgeons are necessarily bad. One of the problems is you don't really know the training of them. We've got some live questions coming in, which is awesome. You don't really know the training, how the training structure goes. So the training might be different. I talk about that in my book. Can I plug my book? Where's my book? So you know, one of the problems is that the sorry, this is well thought through, isn't it? Anyway, I'll talk about this in the book, and it's just that you don't know the level of training of doctors in those countries, and there you go. Anyway, don't know where it is. Got those in somewhere, I'm sure. So yeah, so you don't know the level of training of the surgeon, so you have to sort of look into that perhaps. But also, I think it's good to be close to home. So if you come from France and come here, and then you ring me up for 2 weeks and say, "Look, it's a bit red," I'll say, "Yeah, let's have a look at it. How's it going?" And you're like, "I'm in France." I mean, obviously, you can do photos and things like that, but it's not as good as the real thing, seeing you in person. So both ways, I would advise if you live abroad, look, have surgery locally. If you live in the UK, have surgery in this country. I think one of the problems is surgery is expensive in this country because we've got indemnity, we've got insurance. We're insured for 10. Well, I say I'm insured for I think 10 million, 10 million sort of level or whatever. Don't get any ideas, all right? But um, publicize that. But anyway, that's what it is. 10 million. I think you have to be. I think everyone is, to be honest. If you work in the hospitals, you have to be insured to that level. Everyone has to be insured to that level. So yeah, cosmetic surgery abroad, both ways. Think about it. And as you say, you go abroad, it's cheaper for a reason as well. You know, the insurance probably isn't quite as robust. So Michelle Bradley Smith, look at that. How long has it been? Now, this is a bit why I said you've got to wait at least 3 months, didn't I? I mean, I'm not. Is it 3? It's probably more than 3 years. But anyway, there you go. What is the recovery time after having dog ears done, please? Yeah, it's ages ago, Michelle. Anyway, unless you've got dog ears and you want them done now, which is fine. Give us a ring if that's the case, or let me know. But anyway, I will answer the question. I will answer the question that has been asked of me. The question is, which is quite clear for anyone to see. So basically, depends on how big they are, Michelle. But if they're just normal ones, which are usually sort of pretty small, not that big, just sort of cut them out. Local anaesthetic. Dissolvable sutures, waterproof dressing, dressing on for a week, dressing off, take the dressing off after a week, don't need any dressing after that. Scar's a bit red and obvious for a few months. It does take a few months for the scar to fade, just like the original scar probably took a few months to fade. But actually, in terms of recovery and in terms of downtime, it's not too bad. So if you're doing a sort of, if it's a driving and stuff, pretty much straight away, really. Day off work, maybe. not really any significant time, if unless you're doing anything particularly heavy. If you care or something and moving and things like that, you might want to take that easy for a week or so. But it's really not a big procedure. And as I say, it's usually can be done under a local anaesthetic, which means you stay awake, walk in, walk out type procedure. So yeah, it's a relatively, there is such a thing, a relatively simple procedure. So yeah, and yeah, long time no see. Good to hear from you. And look at this, thick and fast. Huh? Look at this, another one. I have a question. I want to start doing some light weights at the gym. I'm 3 months post-op breast all. Will this be okay? Also on a jog, they tingle quite badly. I'm thinking this is still normal. Liking the emoji there, Caroline. Is that a monkey? Is that a monkey emoji? Where did you get that from, my friend? Where do you get the monkey emojis? I haven't got that in my list. Oh, it's massage. I've got a massage emoji. Right. Oh, wait a minute. Anyway, is that? Oh, it's a cloud. Anyway, see no evil. Respect to you. If I could give you a thumbs up for the emoji, I would, but I can't on this thing. So I will answer your question presently. I'll tell you what, Michelle, lovely to hear from you. You can private message or you can get in touch. Hope you're well. And if you have got dog ears, let me know and I will fix them. No problems. You have to see my new clinic. Have you seen my new clinic? Have you? Right, Caroline. Okay, so when I jog, they tingle quite badly. Tingling is actually not necessarily a bad sign, and it is often a sign of healing. However, jogging is quite boom, 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 is quite sort of impactful. So if they're tingling quite badly, I would say that's maybe saying take it easy a bit. So obviously you've got a good sports bra, but I think 3 months is quite early. I've got to say, I normally say things start to settle at 3 months. Start 6, 12, 18 months for it to properly settle. So it's early days, Caroline. So go easy on that jogging, please. And it's sort of that links in with the light weights thing. Light weights to the gym. You can now start doing light weights at the gym. Yes, you can. And it's all about seeing how you go, seeing how you feel. And as I say, tingling in itself is not a bad sign, but the quite badly thing makes me think tingling quite badly doesn't sound, So if something if you start doing your light weights, and they start tingling quite badly, or they start swelling up, or they start getting uncomfortable, which they might, listen to your body and see how you feel. You're not going to do any harm by starting to do some weights, and you'll want to get fit and what have you. So obviously it's good to get back into stuff. So I think it's good to get back into weights and jogging and all these things. I think they are good. So I'd encourage you to do those things, but I'd encourage you to start gently and build up. So if it is tingling badly, maybe say, just ease off a bit and then build up. But I think that's fine to do, but listen to your body. But as I say, at 3 months, you're not going to do any harm. You're just going to maybe make it a bit longer to settle if you do too much, go too crazy. Well, that's it. I'm out. I believe I'm out. Am I? I've done the ones. What was I supposed to talk about? I think I've talk about dog ears. Hold on, Caroline's coming back at me. She's back at me. Maybe not that bad. But you're exaggerating for the telly. Yeah. Okay. Well then, fine then. In that case, fine. Carry on. What is? Oh, it's angry man emoji. Oh, what's this? So Caroline, that's fine. Then in that case, if it's not too badly, what is this? Badge Ranil has posted a link as a question. Plastic surgeon Cole Carter. What is that? Is that are we supposed to click on that and go to Cal? Is that Cal? Is that, I don't know. Anyway, thanks for tuning in, Badge Ranil, and thanks for your link. That's guys, plastic surgeon Cal Carter. I'll be in touch soon. By the way, you're still the best around. Still got it. Still the best around. Leave that on, but I'm going on. I'm going to come back to that just because Caron. I'm thinking about Caron. When I go away, what is the recovery time? Nice, nice. Like your profile pic, Caron. And just in case you're wondering, I am still the best around and the only one that Michelle would recommend. And do be in touch, Michelle. Be good to see you and come and see me in the clinic. So, Caron, it is, you're absolutely bang on. And you've obviously done your research there because you're saying when I've reached my target weight. Because a lot of people think, oh, I'd get rid of the sort of weight when I do the tummy tuck, But you're absolutely right to get rid of the weight first. You must get rid of the weight first. So well done on that one, because you don't want to get you. The reason you need a tummy tuck often is because you've lost weight and having children. Those are the two things that do it. So you don't so you don't want to. Let's put that up there. Thank you. Yeah, I've said. Caroline agrees with Michelle. So you don't want to. Thanks, Caroline. So you don't want to have a tummy tuck. Make it as tight as you possibly can with a tummy tuck, and then lose weight afterwards, because you'll be left with some redundant skin, and it would have been that you've been able to move more skin. The other thing is your complication rate is less when your weight is less. So two good reasons there to lose weight first. So that's absolutely a good thing to do. Recovery time for a tummy tuck. Tummy tuck's a big op. So having said all that stuff about the dog ears, saying, oh, you're up and you're out the same day and you're all not too badly knocked back. A tummy tuck, you do get knocked back, I'm afraid. So you have to be prepared for a bit of a knockback. It's a big bit of skin that gets removed when you do a tummy tuck. Big long scar goes from hip to hip. There's also a scar around the belly button. The whole point of doing a tummy tuck is to make your stomach tight. You want to make it tight because that's the reason you're doing the surgery. So therefore, when you first have it done, it feels really tight. So you, when you wake up from the surgery, you're bent double. You sat up and you've got pillows under your knees and you're bent double. And when you get up and start walking around, you start walking around all bent over. So it is a big deal. You'll be in. I use drains. Which are tubes going to bottles. We can talk about whether or not, pros and cons of drains. Done a blog post, I think, about that a little while ago. But anyway, I still use drains for tummy tucks. And so you have these tubes and bottles, and you're walking around like this. And I normally say average is 2 nights in hospital. I would say is average. Occasionally, pretty uncommon to be 1 night in hospital, to be honest, and sometimes 3 nights in hospital. So I'd say average 2 nights in hospital. See how you feel. Once you're up and walking a bit better and drains come out, then you can go home. You go home wearing a binder. We put a binder on you. You come back after the first week, take all those dressings off, and then in that week you'll be sort of hunched over. And when you come back after a week, you'll still be bent over double a bit, and still be a bit uncomfortable. So that first week, you're not going to be doing a great deal, to be honest with you. You'll be pottering around the house. You'll be moving because we don't get DVTs, we don't get clots in your legs and stuff like that. So we encourage you to move and potter about, but you're not going to feel like doing a great deal, because it is quite a big op. It takes about 2.5, 3 hours, give or take. So it's quite a long anesthetic, and you will feel quite knocked back. After that first week, you take all those dressings off, so you don't need any dressing after that first week. And then second week, you'll be feeling better. So if you do like office job, or maybe not office job, if you do like work from home, you'll be able to work from home and you'll be feeling a bit better after the second week. I normally say minimum really 2 weeks for driving, 2 to 3. It's hard to say that everyone's going to be okay at 2 weeks. It might be better to say 3 weeks for driving, just because seatbelt and all that sort of stuff. So 2 to 3 weeks driving, but second, third week you will be feeling better. I encourage you to walk. Again, after about 2-3 weeks, driving things, gentle exercise bike, stepper, gentle, a bit like I was saying to Caroline. She's a bit further on and different surgery, but the general principle is just listen to your body, and see how you feel. And if you can do stuff, then you can build it up gradually. So after 2-3 weeks, you'll be starting gently doing sort of lower body exercises and things, nothing too crazy with your core. And then again, going back to work, I guess if you're a sedentary job and just desk-based job, maybe 3 weeks, you'll be able to get back to sort of it, but maybe phase return, give you a sick note if you need phase return or light duties to start off with. And then it's 4 to 6 weeks. So usually, month or two, really. Well, it'd be 4 to 8 weeks, wouldn't it? Anyway, okay, 4 to 6 weeks before you're doing anything too crazy with your upper body. Weights and stuff like that, lifting if your job involves lifting and things like that. And even then, even at the 6 week mark, I'll say to you, take it easy, see how you feel, and if you feel okay, then build it up. So it doesn't mean that sort of 6 weeks you'll be lifting and doing good big weights and stuff like that. It's just gently getting into it at that time. So scars and things like that takes about 3 months for the scar to settle, to start to settle. So it's a bit red and everything. Dog ears, just talking about earlier, little bumps at the end of the scar. These sorts of things really start to settle around 3 months, but can take 6, 12, 18 months. A year really is where your scars really started to fade and the tingling, you feel funny and numb and all that sort of thing, feel funny sensations. Around a year, it sort of starts to sort of feel a bit more normal. And it can take 18 months for it to, even 2 years for everything to really properly settle. So it can take a while for it all to really, but obviously back at work and all that, but for the scars and the shape and the dog ears and the swelling and all that to settle. So yeah, that's that one. Oh, sorry, I've already put that one up there. Yeah, that's Caroline. Yeah. Thanks, Caroline. If you're wondering what she's referring to, that's Michelle saying he is the best around, the only one I'd recommend. So not my words. Right. So Louise is coming in at this point. So Louise, a nice one. Well done for coming in. Thank you very much for asking me a question. And Louise's question is, I'm interested in having a boob lift without implants. How is recovery and pain afterwards, please? Thanks. So the thing about all this surgery is that the good thing about a boob lift is that it's all soft tissue, in that it's all sort of skin and fat that you're having the surgery on. You don't actually cut through any muscles and what have you. So the surgery, the recovery is not too bad, but it is quite a big op. I think sometimes people, when they think about boob operations and boob surgery, they think, in and out, lunchtime sort of job. But a breast lift is actually quite a big op. It's again 2.5, 3 hours. It's not a quick one. It's quite a big deal. And again, it knocks you back. The anesthetic knocks you back. And you'll feel tired, you'll feel jaded. You're normally in hospital just overnight with a boob lift. You have all these tapes on. And again, the reason for the boob lift, the point of the surgery is to tighten the skin. So everything feels tight, everything feels quite swollen, feels quite tight. Oh God, it's all like that. To start off with, as I say, you're in hospital overnight. I tend not to use drains for a boob lift, so you won't have any tubes or anything like that. Have all these tapes on. You can't really wash or shower when you've got the tapes on. You can sort of sit in a shallow bath, but you can't really get the tapes wet. So come back after a week, take all those tapes off. Then you don't need any dressing after that week. So again, that week you're not going to feel great. Second week you'll be feeling better. Again, desk working from home and things like that. I'd say again to be safe, 2 weeks for driving. You might be okay after a week, but probably say 2 would be safe for driving. And again, light activities like exercise, bike, stepper, getting out and about would be 2 weeks. Shape's a bit weird when you first have it done, and you show you photos and things of how the shape looks when you first take those tapes off. You think, oh my Lord, what's going on here? It's all like that. It looks all a bit weird when you first have it done. So you have to be prepared for that. It takes a few weeks and probably even actually a few months for that shape to settle. So you have to be prepared for that. After a couple of weeks, start getting back into things. Again, if you're doing a desk-based job, you might be able to get back after 2 weeks, driving and stuff like that, but nothing too heavy. I'd normally say light duties or phase return. Again, 4 to 6 weeks for anything too heavy. If you were doing any work that involved heavy lifting, or if you wanted to get to the gym and you wanted to do heavy weights with your upper body, I would say leave that for about 4 to 6 weeks and then gently get back into it. The main reason being that you're going to make it swell. If you go for things too soon, you're going to make it swell. And if you make it swell, because sometimes people go back to work too early, or they think, oh, I'm going to go to the gym and that sort of thing, if you make it swell, it just takes longer for it to settle. So it's a bit of a false economy. So really give yourself time. Realize it is quite a big operation, and give yourself, I would say, 6 weeks off for the heavy activity with the gym. You'll be doing light activity like stepper and exercise bike gently, but it does take 6 weeks before you start doing upper body stuff. And again, scars are red and obvious for the first few months. It starts to settle around 3 months. Same with the shape. Shape starts to settle around 3 months, really, 2 to 3 months for the shape to start to settle. Can take a while for it to all fully settle. A year or so for that scar to settle completely, and the numbness and the weird sensations. And also the thing about a lift, as I was saying earlier, you have to be prepared for the shape, because you might say when you first have it done, oh, I like this is good, I'm happy with that. It does settle, and it does give a little bit less fullness in the upper pole, and that does tend to settle. So that's something to be aware of, because you're dealing with natural tissues, and natural tissues are acted on by gravity. Much as we try and push them up, they are acted on by gravity, and they do tend to settle. So that's something to be aware of before you go ahead with it. So basically, the pain isn't too bad. I've got to say. Well, I've had it done, but what people tell me. But it does feel tight. It does feel tight, and it does feel strange. You definitely know you've had something done, but you're not like in pain. It's just like, oh, it's a bit tight. It feels a bit uncomfortable, and then it takes time for it to soften and settle. So Caron says, thank you. You're welcome, Caron. You're very welcome. And yeah, sit back. That was a slow start, guys, but that was a good end. I'll tell you. Well, if this is the end, is this the end? Is this the end? If this is the end, that is a good end. I'm happy with that end. I'm happy to the extent that I will put some happy faces in. It's quite hard to see, is it? Oh no, they're not. What do they wink? They wink. Oh, they're winks. Anyway, so yeah, thank you very much. Oh goodness me. Anyway, don't know what's happened there. So yeah, that was a good one. That was a good one. I was a bit worried to start with, because I thought there was a bit of a slow one. But Angie got in there early, so thank you for that, for kicking the ball rolling. It's like anything, once someone starts, then it just roller coasters. So that's that. I'm going to check out of this, and I'm going to go and just go and live. And I suggest you do likewise. I will see you next week. And if you have any questions, please do what you've done today, which is get on here. And if you want to ask a question while I get this up, if you want to ask a question, then just email me or text me, or text me. No, don't text me. Email me or Facebook me or Twitter me, or do whatever, and I will be very happy to oblige. Thank you very much for that, for everything. And I'm ending this right now. Thank you.